You said a moment ago that it was near certainty that children would get it. Now, what proportion of children do you think have already had it? I know the ONS is estimated recently 50 to 70%, but what's your estimate of it, perhaps?
It varies by age, and it does also vary by setting. But I think if we go for roughly half, I think that is a reasonable stab at this. But that obviously means you've then got half who that's half over the period of the entire epidemic to date, and we've got quite a way to run. We're running into winter, so there's still quite a lot of damage that could be done in terms of disruption.
You said it's a near certainty they would get it, but the estimates that you've published on the gov.uk website of the effects of the vaccine is that if the children were vaccinated to prevent 40 to 60,000 cases. So I appreciate you're assuming in that you get 60% vaccination, so there's a potential for that to increase. But you're talking about 1.5 million children in this age group that have not had the disease already. So why is there such a big discrepancy between those two numbers?
Well, what we're assuming is, firstly, that the vaccines are not fully effective for the reasons Professor Lim was talking on, and secondly, we're assuming, and if you're talking about, I'm assuming you're talking about the modelling papers that have been done here.
So you're saying you've got 3 million children, of which 1.5 million children have already had it, and so arguably the vaccines don't really help them at all. So you've got one.
No, that's not actually. Well, let's come back to that. That's not actually strictly true. But
entirely.
Okay. So there's a group of people who've not had it who. I mean, let's make an assumption that the great majority of children who've not currently had COVID are going to get it at some point over the next period. It won't be necessarily in the next 2 or 3 months, but they will get it sooner or later because this is incredibly infectious, and because immunity wanes, we're not going to see a situation where it just sort of stops at a certain point. So over the next years, we will see that happening. Now, vaccination will reduce that risk, as Professor Lim was saying, by, I'm going to say for the sake of argument, 50%. It's probably slightly more than that, but 50% for the sake of argument. People who've already had the infection, some of them will go on to get it a second time, that we know, and so the vaccination will further reduce that number, and it won't produce a complete protection for those who are vaccinated, and there'll be some people who won't even get infected at all, but there will be a really very small number. You can put a lot of different assumptions into this, and the bit that we don't know most, and the one that's going to have the biggest impact, I think, in the medium to long term, is how rapidly does this wane in terms of protection, assuming no new variant, and that's a very important assumption, but assuming no new variant, that probably is the thing we don't know most. So the confidence intervals around almost all of the numbers are really quite wide, so we can give broad indications of this, but I think with all of these, and the modelers would agree with this, no one should put too much emphasis on individual numbers. I think you have to see them as a sort of central projection within quite a wide range.